HIV counseling documentation for patients whom now have a confirmed result of positive, HIV positive, or they have the AIDS infection. Preliminary or confirmatory positive test results should be notated in the record. Referrals for medical care and any supportive services should also be noted in the record. Follow-up care to confirm continuum of care. Prevention, risk factor reduction counseling, the care plan, partner counseling and assistance, including domestic violence screening. So these should be documented in the patient's record once there is a confirmed result. Additional documentation points, the medical provider HIV/AIDS report and partner notification. So again, you have to check with your local Medicaid state agency because some states require it and some don't. Annual assessment documentation should consist of prevention, risk factor reduction counseling and follow-up care plan, and partner counseling and assistance for domestic violence screening. So these are the components of the necessary documentation elements that should be in a medical record. While various states suggest the use of the rapid HIV test, most providers may prefer to do the blood screen test. So again, check with your local Medicaid agencies. We're going to look at a few slides and upcoming slides that will provide you with the detailed codes that you can use for rapid HIV testing versus the blood draw, where you send the labs out to an independent lab, or maybe you have a lab on site that you use. So you have to check with your local Medicaid state agencies and the insurance plans that you participate with to determine specifically how they want you to report those. So the first set of codes that we're going to talk about that utilize pathology and labs services would be from the CPT coding book. So if you were on the call last week, we spoke in depth about the evaluation and management codes, which are also out of the CPT coding book. This webinar series will look at the pathology lab codes out of the CPT coding book. The CPT codes were developed by the American Medical Association in 1966. The codes are reviewed and they are updated annually, and the new code set becomes available every year on January. The CPT codes describe procedures and services that are performed to treat medical conditions. So in the case of the pathology and lab codes, these are the codes that are used for the diagnostic tests and for therapeutic testing. These codes are reported on professional claims as well as on institutional claims. But it's my understanding that most of the providers on the call are professional providers that have their own practices or work in a practice setting. So these CPT codes are appropriate and applicable to your setting. Another code set that we'll be discussing are the HCPCS codes. HCPCS is pronounced, the acronym HCPCS stands for Healthcare Common Procedure Coding System, and it's spelled, well, it's pronounced, if you would try to spell it, it's HICKS, PICKS, HCPCS. The HCPCS coding system was developed by the Centers for Medicare and Medicaid Services in 1983. These codes are also updated annually and available for use in January. The HCPCS codes describe procedures and services that are used in supplement or sometimes in place of CPT codes. If you were to take a look at a CPT code book and do a comparison, you would find that approximately 80% of the HCPCS codes map to the CPT codes. And typically with HCPCS codes, these codes are reported for services that are rendered to patients that have Medicare insurance. Some insurance carriers, including Medicaid, also require the use of HCPCS codes. But again, you should check with all of your carriers to find out which code sets they want you to report. Because even though coding guidelines may say one thing. They may tell you that these are the correct codes. A payer may come along and say, we want you to use these alternate codes. So it's ultimately up to the payer, their discretion in terms of which code sets you would be using. So the first type of codes we'll look at are the HIV antibody test codes. These codes describe tests that look for the presence of the antibodies that are produced in response to the presence of the HIV infection. So if you'll notice, the first three codes on this slide are for the rapid HIV test. The G0435 is also a rapid HIV test code. Your 86689 is a confirmatory test code. So in terms of the code sets that you would, in terms of the types of codes that you would be using in your office for point of care, you can use 86701, 86702 if it's for a patient that you suspect may have the HIV-2 virus, or you could use the 86703 for HIV-1 and 2. The G0435, again, it's required for any of your patients that have Medicare insurance, and it may also be required by your local Medicaid state agency. So you should check with them before submitting any codes on this in this presentation. The rapid HIV test point of care test codes provides real-time screening and results. Some of the most common that are on the market currently are Alair, OraSure, Trinity. So those are basically the most common. Typically, one test is payable every 6 months, but that may vary from state to state. So going back to the previous slide where you see the 86701, 86702, 86703, and G0435, these are the codes, if I can remember how to use this, these are the codes that you would use to report the rapid HIV test. If you prefer to draw blood work, when a patient comes into your office, you would report one of the E&M service codes that we discussed last week, along with the venipuncture code 36415, which is here at the bottom of your screen. And what happens, you would then send the specimen out to the lab for processing. Now, in the event, here's some additional codes, so let's talk about these first. The HIV antigen code, it tests for the presence of the infection. So let's go back to the previous slide. You have one set of codes that test for the antibodies, and then you have the other set of codes that actually test for the presence of the HIV infection. And you'll notice we have three rapid point-of-care test codes on this slide, G0432, G0433, and 87389. So again, you want to check with your local Medicaid state agencies to determine which codes they want you to report for the rapid services that you are providing in your clinics and in your office settings. Another set of codes, and these are more so for the labs. So if you have a lab that is set up in your practice, then when you draw the blood work, you would report the E&M service code with the venipuncture code 36415, and then you would send the specimen downstairs to your lab or off-site to the freestanding lab that processes the blood work, and then they would report one of these codes. So as a provider, you would not be reporting these codes. But the codes are here on the presentation because there are oftentimes facilities and practices on these calls that have a lab on site where they send downstairs, upstairs, or wherever it's located to do to process the specimen. So let's take a quick, let's take a couple of minutes to do another polling question. The acronym HCPCS stands for A, Hospital Care Procedure Coding System, B, Healthcare Procedure Coding System, C, Healthcare Common Procedure Coding System, or D, Hospital Clinic Procedure Coding System. Please take a moment to take the poll. Okay, so let's see. It looks like we have an overwhelming number of participants that have selected choice 3. So let's look at the first 2, because no one selected 1. I'm sorry, no one selected number 4, and that's correct. This one is not one of the choices. We have 6% or 1 person selected Hospital Care Procedure Coding System. The HCPCS acronym stands for Healthcare Common Procedure Coding System. That's number 3. So if you selected number 3, you got the correct answer. So let's talk about modifiers. We spoke about modifiers in webinar series 1. The modifiers that we spoke about were specific to the evaluation and management codes. The modifiers that we'll talk about today are specific to the HIV test codes. So modifiers are 2-digit, sometimes numeric or alphanumeric codes that indicate that a procedure or service has been altered by a specific circumstance but has not changed that actual code's definition. There are CPT modifiers and there are HCPCS modifiers, and we're going to look at some in a moment. Modifiers impact your reimbursement, so it's important that you find out from the payers before you utilize the modifiers. Modifiers should never be reported alone. Modifiers are never reported on diagnosis codes. We'll cover the ICD-10 codes in Series 3, which is scheduled for next week. In terms of modifiers, you should follow up with your Medicaid state agency to determine which modifiers are approved in your state, because it varies from state to state. So the first modifier that we're going to talk about is modifier 92. In a nutshell, the description of the modifier denotes alternative lab platform testing. This modifier denotes that this is a CLIA wave test. This modifier is only reported on path lab codes. So here's the range of all the codes in terms of this particular modifier. This modifier should not be reported on any other code types. So if you were on the evaluation and management webinar last week, this modifier would never be reported on E&M codes. Typically, this modifier is not reported on HCPCS codes, but again, you have to check with your local Medicaid state agencies because they may tell you to report this modifier on HCPCS codes. So again, we're just going over the coding guidelines. The payer guidelines is what determines how you're going to be reimbursed. The second modifier is also describes CLIA wave tests. This is modifier QW. This modifier is commonly used, but again, depending on what state you're in, your payer may tell you to use modifier 92. So both the modifiers basically mean the same thing. It's just depending on what state you're located in that will determine how you're going to report the modifier. Modifier QW is only reported on path lab codes. Do not report this on any other code types. So this would never be reported on E&M codes. If you're performing a combination of wave and non-wave tests, then you should not be reporting modifiers. So the wave and non-wave test would be a rapid. So if you're performing a rapid HIV test and then you follow it up with blood work, the coding guidelines say do not use it. But again, you have to follow what your payer tells you to do. So let's look at A few case studies. This particular webinar series was very, very short in terms of the amount of codes that are used. So before we actually start to look at any of the case studies, does anybody have any questions about the types of codes and the types of modifiers that are used to report the HIV testing component? Or does anybody have any questions about the documentation component? Okay, so then we'll go right into the case studies. Basically, we're using the same case studies throughout the webinar series, but we'll be focusing on the codes based on that particular topic in the webinar series. So this is a rapid HIV test with preventive care, and even though it says preventive care here, we're only talking specifically about the test. So this is a 27-year-old patient that presents to his primary care physician's office, concerned about recently having unprotected sex, and requests an HIV test. The physician decided to also do a well visit. But again, we're just talking specifically about the HIV test code component. So the physician decided to do a rapid test, and he selected CPT code 86701. And in this case, you can use modifier 92 or modifier QW, depending on what your local Medicaid state agency or what your participating insurance plans tell you to utilize. So now, because this was a point of care test, this is one of the codes that are available for use for this particular service. This was an established patient, but again, we're just talking specifically about the CPT code for the HIV test. So the physician selected 86701, and this needs a modifier to denote that this is a clear wave test. And again, based on your state, you would use 92 or you would use QW. Rapid HIV testing with counseling. So a patient presents to her primary care physician concerned about recently having unprotected sex, and the doctor does a test. So it's the same answer, 86701, with a modifier 92 or a modifier QW. So I'm going to skip along to number 3. Okay. A 47-year-old patient presents to their PCP concerned about unprotected sex. The physician counsels the patient, and he draws blood, and he sends the specimen to the lab for processing. So in this case, because there was blood work involved, you would select one of the non-rapid test codes. So in this slide, you'll notice there's a range, and dependent upon the methodology and the type of test would determine which one of these codes you would select. And since this primary care physician has a lab on site, these were sent downstairs for processing. And so in this instance, the PCP would not be utilizing these. So again, this particular slide is specific to those practices that have a lab downstairs or on site, and these are the codes that the pathologist would use to report these services. If you're the PCP or the internist, you would report one of the evaluation and management codes, and you would report the venipuncture code 36415, which was covered last week. So here's the rationale. In this instance, this was an HIV antigen test code, antigen test service. So here are the codes that it would have been selected. And since this was a service that was performed by the pathologist, meaning this was not a rapid, these services were sent downstairs to the pathologist, and the pathologist would report one of these. No, actually, let me go back. I think there's a mistake here. Give me 1 second. Where are we? These are the rapids. Okay, so I apologize. Let me go back there. We have okay. Let me go back there. Okay. So, okay, so yes, these codes can be reported by the pathologist, yes. So these codes are sent downstairs, even though they're in the rapid category, some certain tests are still sent down to the lab for processing. So these codes would qualify in that particular category of service of code types. So these would be sent down to the pathologist also. At 47, this is a confirmatory test. So basically, the physician performed a rapid HIV test, and maybe perhaps it was positive, and he decided to do a confirmatory. So, 47-year-old patient presents to the primary care physician's office for follow-up of an inconclusive HIV test result, and the physician performs the confirmatory HIV test. So he counsels the patient and advises the patient to return for their results. So here's the code that would be utilized for that service, 86689. And then you have your modifier 92 or your modifier QW, depending on the state that you are reporting these services in. So this is another one of those codes that would not be reported by the PCP. This would be reported by the pathologist. And so this would be a service, this would be a code that would be used if you have a lab on site, or if you're sending it off site to an outside lab. The pathologist off site would use those. And then here's the rationale for the reason why we're reporting CPT 86689. It's the confirmatory test code with the modifier 92 or QW, depending on the state that you're located in. So this is a pre-exposure office visit. We have a medical office assistant that accidentally punctures their finger while drawing bloods on a patient that has AIDS. The office manager completes the paperwork. The physician examines the patient and provides a 48-hour supply of medication. So the physician's office would report the routine venipuncture code 36415, in addition to one of the E&M codes, which was covered in last week's presentation. So the E&M code would be a 99203, because we're presuming that this medical office assistant was not ever treated in this office. So it would be one of the 99201 through 05 codes if it's a new patient. If it's an established patient, going back to last week's presentation, it would be a 99212 through 99215 with a modifier 25. So but specifically to the test codes, your test codes would be 36415 for the venipuncture, and then the 87390 through 87389, one of the antigen codes. In terms of the diagnoses, we will cover in depth the ICD-10 codes in webinar series 3, which is scheduled for next week, Thursday. So here's the rationale for the reason why we selected 36415 and 87390. So as noted here in the rationale, you would utilize the E&M codes for the medical component of the visit, the 36415 because we drew blood, the CPT 87390 for the specimen, and in some states, the insurance carriers do process and pay for the conveyance and processing of a specimen, which is CPT code 99000. So you should check with your local Medicaid state agencies, because again, some of them do actually pay for this. So in any of those examples that we just looked at, if you are drawing the blood and you sending it out to an external lab, then you can utilize this additional code, but most health plans don't cover it. So you want to just follow up with your local Medicaid agencies and all of the health insurance plans that you participate in. A lot of the practices that I do coding education for, they merely like to report it for statistical purposes only, just to track how many of the specimens they're sending out versus how many they're doing as an oral point of care test. So let's look at another polling question. This time this is a true-false question. True or false? Point of care tests are reported by MDs, NPs, and PAs, not pathologists. Okay, looks like everyone's finished. So we have 75% of our webinar participants selected true and 25% selected false. So this was actually a trick question in accordance with the coding guidelines. The coding guidelines say that you cannot report them. I'm sorry. In accordance with the coding guidelines state that point of care tests are only reported by MDs, NPs, and PAs, but some health plans do allow pathologists to report these. So again, you just have to make sure that you are aware of what's going on in your state to determine what you can and what you cannot report. So the answer is true, but you should still check with your local state Medicaid agencies. So some coding tips, point of care, rapid HIV testing, and preventive care, including counseling. So in terms of the rapid test, you would select the CPT or the HCPCS code based on the methodology. So whether it's an antigen or an antibody would determine which one of the codes you select, and based on whether or not your insurance carriers want you to report the CPT code or the HCPCS code. Depending on which state you live in, you would also determine whether to report modifier 92 or modifier QW. So again, it's very important to know what's going on in your state, and also keep in mind that each insurance plan has their own specific medical policy and claims policies. So just because one insurance carrier may tell you to use 92 doesn't necessarily mean that that applies across the board. So you want to check with all of your carriers. In one state where I've done the coding webinars, they don't want the practices to use modifiers at all. So again, this is something that you need to find out from your insurance plans that you participate in and the local state Medicaid agencies that you are submitting for the states that you're submitting these claims for. Also, if you have patients that come in from another state and they have coverage from another state, you have to follow up with that respective state where the patient has coverage to determine how they want you to report the claims, because it may differ from how you report the claims for your local carrier in your state. Point of care rapid HIV testing without preventive care. So same thing, you would select the code based on the methodology and you would select the appropriate modifier. If it's an HIV testing or confirmatory test processed by a pathologist, then you would report the confirmatory test code 86689. So here are your HIV testing codes that can also be reported by pathologists, and then this code 86689 is specific to just the pathologist. In terms of certain coding guidance, if the lab specimen is processed the same day as a rapid, so let's say a patient comes into your office and you do a rapid screen, you have to check with your local Medicaid state agencies because they may not pay for a rapid and the actual blood specimen. So you have to check with your payers. But the coding guidance says to just report one code, and that would be for the lab specimen. There might be specific guidance in your state. They may want you to report both the rapid test as well as for the specimen if you have a lab in your facility. So here are some of the web resources that were used to prepare the presentation. Centers for Medicare and Medicaid Services, the Food and Drug Administration, the American Medical Association, NCHS, Centers for Disease Control. The coding specific resources were the American Academy of Professional Coders, American Health Information Management Association, the American Hospital Association. This is a physician professional organization, the American Academy of Family Physicians. So all of these web resources you can go to for support to get information about the codes and also documentation tips. Some other resources that you should have in your facilities, the CPT coding book, the HCPCS coding book, and if you can get yourself copies of the E&M pocket guide. A lot of providers find this helpful in helping to select the appropriate E&M levels for services that they're providing in their practices. So remember, the CPT codes are 100% numeric. The HCPCS codes are those alphanumeric codes that begin with the alpha G for the purposes of the HIV testing services. And now I'm going to turn it back over to Samantha.
Thank you so much, Stacy. If anyone has any questions, please feel free to type them into the chat box so Stacy can answer them. And again, just a reminder, if your organization would benefit from technical assistance on enhanced medical billing practices or any other topic related to fiscal management and grants compliance, please contact us. My email is samantha@healthhiv.org. And does anybody have any questions for Stacy before we wrap this up? It looks like that we don't have any, but if you do think of anything, please feel free to email me, and I'm happy to put you in touch with Stacy and get your questions answered. And also, we uploaded today's slides into the folder. So again, if you would like to download them, print them, use them however you wish, they're available. And this, as well as the webinar and slides from last week, will also be on the Target Center. And the registration form for the third and fourth webinars in the series, if you have not registered yet, that's also in the documents folder on the bottom of the screen. And we hope to see you all next week. Thanks so much.